In this video, I'm going to show you how to correct forward head posture. If you were in my office and you were here to fix a postural problem like forward head posture, part of your treatment would be professional head weighting system just like that. If you explore my channel, you're going to see a lot of videos on how to fix your forward head posture, how to fix a whole bunch of postural issues with exercise, traction, and ligament stretch. This video though is going to fill in the gap. This video is going to show you how to retrain your neuromuscular system to help maintain automatically better posture by reminding your nervous system to fire the right postural muscles to get you back upright with good posture and good health. You can do all of this in the comfort of your home without any professional equipment, and I'm going to show you how right now. My name is Dr. Jon Saunders. I've been treating patients for over 22 years with spinal-related conditions, everything from sciatica to cervicogenic dizziness to pinched nerves to, of course, postural issues. Forward head posture, rampant in our society. What it does, you come forward like this, it compresses discs, puts tension through nerves, causes our spine to break down prematurely. It contributes to a whole bunch of things. In addition, it makes us look less healthy and less vibrant than we once were. Now, oftentimes we want to treat these with exercises, which is important. In our office, we do specialized adjustments, exercise, corrective traction. But when you're at home, there's a few easy things you can do to help train your nervous system to hold better posture by causing these muscles to turn on. Now, you are going to need a few things. You don't need any professional head weighting system like we use in the office, but you're going to need a couple things. You're going to need a baseball cap, a baggie, one Theraband. So you need three things: a hat, a baggie, and a Theraband. I'm going to show you how you can design some equipment at home that's going to help your posture go from this to this. So go grab your baseball cap and a baggie and come with me. I'm currently at my office, so I don't have access to a lot of things, but what you want to do is you want to fill your bag with either some rice, sand, anything that's going to add a little bit of weight. I'm going to use a little bit of water here. And this is how we're going to make our homemade version of our head weighting system that's going to help you get rid of your forward head posture. You want to make sure you have a little bit of weight in the bag, so let's go back and grab your baseball cap. Okay, if you're at home, I'm going to suggest you use anything but water. It was a bit tricky, but I got it on my hat, and this is the point. You put this on with your rice or whatever you have, and you're going to notice some weight. If you don't hold and activate these muscles, okay, your head's going to want to come forward like this. So it's forcing you to activate your postural muscles. The key here is making sure you start to move around you start about a minute or two a day, and you work up to about 15 minutes where you're literally walking around your house with your weight anterior to your head, forcing that upright reflex posture that's going to fire all the appropriate muscles right up to your skull or occiput, right down into your middle back, and even in your lower back. You might need to start with a really light weight because it might be actually difficult when you first start doing it, but I can tell you this alone is going to start to change your posture instantly. And already right now, just holding my head in a better position, away from this position, it's going to slowly, as you start to move around and your neurology starts to fire the right way, you're going to notice you're upright more than you were 2 minutes ago. So this is your first thing. This is not the only thing. I'm going to give you two more things that's going to wrap this together, that's going to give you the best chance to fix your forward head posture at home very simply. So let's go on to the next thing. Play around with this. I know you're going to love it. I just looked back at that clip and just realized how silly I look, but it doesn't matter. You're in the comfort of your home. Do it, and I know you're going to feel much better and much better posture. So now let's get on to the next thing. You need to have a band, and it could be a band that's already in a loop. If you don't have something that you're going to do, because we're going to start to work the isometric muscles now with an isometric contraction. And this is done very simple too. We're going to fixate the band. And so all we're going to do, again, we're going to put this on the back of our head. We want to step away from the wall, and you want to get it at about eye level or slightly higher. And all you're going to do is you're going to step away just so that you're activating. And so if your head is like this, we want to pull back our shoulders and hold. We want to hold this for at least 30 seconds, but you really want to start to work up to about 90 seconds when you're getting stronger. Now this is going to, again, is a static movement, so it's going to fire. If you pull your shoulders back at the same time, your head comes back, you pull your chin in. You're firing even muscles in your glutes to really activate and get that posterior chain firing. This is going to support the head weights that we just did. It's going to support the neurology to help your neurology learn and relearn what good posture is, so it becomes automatic to you. So again, you can use any type of banding system. Make sure it's secure, make sure it's not going to pull through and the band's going to hit you in the face, but you want to really start to work on this immediately following the head weighting system. And then the final thing we're going to do, we're going to get right into the next exercise, and this is simple. We're going to get right to the wall, our ankles on the wall, our glutes on the wall, our shoulders pulled back, and if you can get your head as far back as you can, you're going to just stand up and you're going to press into the wall. So our shoulders, our arms, and our head very gently. Once you've done this, if you've worked at the head weights with say 2 to 10 minutes of that, and then you've done your 30 to 60 to 90 seconds, 3 sets of the band, and come right into this. So these things have to follow one another. You're really going to notice, even when you've done it just the first round or first set of all 3, you're going to walk without having to think about how much your posture's improved. Now, because this is new and your neurology has a pattern to pull you back, when you stop thinking about it, you're gonna go back into that position. But if you do this on a day-to-day basis, I recommend you doing it at least 5 days a week. It won't take you long. You're gonna automatically hold your posture better. Your head's gonna come back over your shoulders, and your health is gonna be improving because your posture is improving. Try it. Tell me what you think. What do you think about the head weighting system? Were you able to find something to make that effective? Did you have a band? Did you have another alternative that you can do an isometric contraction like I showed you? And then finally, once you've done the third part and you're up against the wall, tell me how you feel. I know you're going to notice a significant improvement right away in your posture. Just a couple tips here to make this more effective. Start slow. A couple minutes a day, working up to about 15 to 20 minutes per day should be sufficient. Make sure you follow along and you do your head weights followed by an exercise followed by the wall stand. It just takes advantage of the neuroplasticity immediately following that to help really reinforce what your posture should be and retrain your nervous system to hold it. The other thing you want to do is make sure that when you're doing all of these exercises, even when you're walking around with the head weight system or your made-up head weight system at home, you're really making sure your sternum is pointing tall, either straight or slightly up, and you're breathing through your diaphragm. You don't want that heavy chest breathing. It fires the accessory breathing muscles, which result in a stressful breathing. You want to be calm and collected while you're trying to fix that forward head posture. And finally, if you have a known condition, cervical instability, degenerative disc disease, or stenosis, make sure you talk to your health provider to make sure that these exercises are okay for your case. If you like videos like this, maybe consider subscribing so you can be informed when I upload a new video. If you want more perks and some access to more connection with me, maybe you'll consider joining our membership as well. Check out the details below. Thanks for tuning in. I want you to check these 2 videos out right now before you go. I appreciate your time. I can't wait to see you in my next video. Until then, stay well.